Today we'll be discussing about syphilis, which is a sexually transmitted disease, and it is a genito-ulcerative disease, as in there's ulceration in the genital regions. Now we'll be discussing about the causative organism, the mode of transmission, pathogenesis, clinical features and the different phases, lab diagnosis, and a little bit of treatment. Causative organism is a spirochete, which is Treponema pallidum, and this under microscopy is very well recognized as a slender, thin, flexible organism with multiple spirals, and also it has a tapering end. Coming to the mode of transmission, most commonly it is spread through sexual contact, and there are non-venereal modes of contact as well. So transmission as well. Non-venereal as in non-sexual modes of transmission. It could be through direct contact with it, or blood transfusion, or even transplacental transmission, that is vertical transmission from a mother to a fetus. Moving on to the pathogenesis, the spirochete is going to enter into the skin or the mucosa through the aberrations which are present, and from there they are going to enter into the lymphatics in the blood and finally produce systemic infection and metastatic foci before the primary lesion. So the infection is produced and a metastatic foci is produced before the primary lesion is appearing. Moving on to clinical features. Now this disease is known as the greatest pretender. That is because it is mimicking the clinical features of a lot of other diseases. The infective dose is around 500 to 1000, that is the minimum dose or minimum number of organisms required to elicit the disease. The incubation period is about 10 to 90 days. There are 4 stages with dividing the entire syphilis into 4 different stages: primary stage, secondary stage, latent stage, and the tertiary stage. Talking about primary syphilis, 2 important things characterized by primary chancre, regional lymphadenopathy. Primary chancre, it's going to be single, indurated as in it's hard, painless ulcers, and it'll have a large amount of spirochetes and thick exudate in it. Where is it present? In the males on the penis, females cervix and the labia, and homosexuals in the anal canal. It is self-limiting. It heals on its own in about 4 to 6 months. Regional lymphadenopathy, most commonly affected is inguinal lymph nodes. These are painless, non-suppurative. There is no pus. See, in chancres there is exudate. There is no exudate or there is no pus in here. In the lymph, it is firm and they persist for a few months. Whereas primary chancres are healing on its own in about 4 to 6 months. An important note about syphilis is that depending upon the mode of transmission, you can determine whether the primary chancre is occurring or not occurring. In case it is spread through direct contact, primary chancres will occur, but in the extragenital regions, not on the penis or the cervix or the labia, but instead you can find it on the fingers. Blood transfusion, there will be no chancres at all. Moving on to secondary syphilis, this will develop 6 to 12 weeks after healing of the primary lesion. Now this is characterized by 3 things. One is the skin rashes seen on the palm and the soles. Condyloma lata, what exactly is it? Maculopapular rashes which are present, they'll coalesce, that is they'll come together to form a pinkish grey lesion which will usually see in warm moist conditions in the body. Where is that? Perianal region or the vulva or the scrotum. And mucus patches, which is usually the mucosal erosions which is seen in the tongue. This secondary syphilis is also characterized by generalized lymphadenopathy. Moving on to the next phase, latent syphilis, is where the person is asymptomatic. The secondary lesion is going to subside, and within 2 to 6 weeks you will see this stage where the person is asymptomatic. There is no clinical manifestations of syphilis. The CSF findings are also normal enough, but the serological tests will show positive for syphilis. That is, the antibody and antigen detection tests will be positive. Now this latent syphilis has 2 phases again, early latent and late latent. The early latent will appear within the first year of the disease itself, and if it is late latent, it will appear after the first year of the infection. But still, even in this latent period, the person is still infectious. What is the fate of latent syphilis? What could happen after latent syphilis? Lifelong infection, maybe the person will have a persistent lifelong infection, which is the most commonest fate. Or there could be development of late syphilis, that is the tertiary syphilis, which is rare, or there could be a spontaneous cure. Late or tertiary syphilis, so this is going to occur in about 1/3 of the patients who are not treated. They will enter into the tertiary syphilis stage. There's gummatous lesions, cardiovascular lesions, and neurosyphilis. Cardiovascular lesions and neurosyphilis will be considered to be quaternary syphilis. Gummatous lesion is where these granulomatous lesions, and it can occur in any organ, most commonly in the bone and the skin. Cardiovascular lesions is basically aneurysm of the aorta and aortic regurgitation, and neurosyphilis, chronic meningitis and vasculitis. Moving on to the most important part, which is lab diagnosis. Firstly, microscopy. Like I already told, these are slender, spirally coiled with tapering ends. Under dark ground microscopy, we can appreciate this. We can also see the motility, which is corkscrew motility. Then we have direct IF staining for Treponema pallidum, silver impregnation method, Levedity stain, which is usually used for the tissue section. We'll use Fontana stain if it is a smear. Culture, it is not cultivable, but it's maintained in the testis of rabbits. Serological tests to detect the antibodies. There are standard tests for syphilis, which are called as non-treponemal test, and there are specific tests which are called as treponemal test. VDRL, which is venereal disease research laboratory test. RPR, which is rapid plasma region. TRUST and USR. Then the specific tests is Treponema pallidum immobilization test, Treponema pallidum agglutination test, Treponema pallidum hemagglutination test, Treponema pallidum particle agglutination test, and FDA-ABS and PCR. Coming to the treatment, the drug of choice is penicillin G for primary, secondary, and early latent stage. A single dose is given. If at all it's late latent stage, penicillin G, a single dose is given for about 3 weeks. Now, if the person is sensitive or resistant to penicillin, tetracyclines will be used.